real emotions healthcare providers and healthcare professionals don't talk about. I'm Marinda Nelson. I help healthcare providers go from bored and burned out in their healthcare career to truly doing what they love. But there's some really real things that we feel along the way or that motivate us to make the moves, to do something different, things that maybe we don't talk about. We talk about burnout, or we talk about being exhausted, or we talk about imposter. We're not necessarily talking about the actual emotions that we're feeling, though. Those are the industry acceptable terms. But I want to break that down further. When we see what we're actually doing, how we're actually feeling, instead of saying, oh, I'm not supposed to feel that way, and pushing it away, when we bring it in and we get curious about it without judgment, that's when we can say, okay, wait a minute, this is how I'm feeling. This is what's going on. Now, do I want to do move? Sometimes things have to get to a place where we are so frustrated, where we are so feeling stuck, where it gets bad enough that we're going to make some changes. And yes, we can be in the cycle and we can go around and round and round and round about this for a while, but eventually you hit a point where I just can't do this anymore. And those of you that care are the ones that we want to keep in the healthcare industry. So I help you eliminate burnout, eliminate this imposter syndrome, and then be able to comfortably and confidently develop, lead, and expand a dream practice that you love, where you get to be the provider you want to be, where it gets to be fun and fulfilling, where you get to feel authentic and do things and say things and wear things and practice your way, knowing that you provide for and protect that space. And it gets to be prosperous and profitable. As a youngster, I had many health issues. I was a sick kid. We were at the doctor's office all the time. I had many, many, many terrible healthcare experiences. But it wasn't until I started to work for the 20 years that I worked in the healthcare industry that I realized how many providers were really, really amazing. And we're struggling with these emotions, with these feelings. They didn't know how to move forward or how to help it be different. This is what I help you do. This is not going to be a series of videos where I say, oh, you shouldn't feel that way. Simply do these 3 things, and then you cannot feel angry or frustrated anymore. We know it doesn't work that way. This is going to be a real conversation about emotions that I felt or emotions that I've talked about with the other providers that I work with in the coaching sections that I work with you, in the programs that I work with you, in the workshops that I've done with dozens and dozens and dozens of providers now. It is in breaking these emotions down. It's in feeling them, allowing yourself to move through it, not judging, not saying that I shouldn't feel this way or rejecting you further, but getting curious about, hey, I do feel this way. I want to look more into that. I wonder where that feeling is coming from. How is this the perfect thing for me right now? What is this motivating me toward? What is it that I've been asking for that this is perfect for? If you ask for peace, say you want more peace in your experience, then you're going to show you all of the places, all of the people, all of what you've created so far that isn't peaceful. And it's going to show up bolder and louder and more chaotic until you recognize and you choose, is this something I'm going to do something about? Or is this something, a place in me that I want to nurture and bring some love and some caring and some healing to? Or is this a belief that I no longer have that I'm going to let go? This is not a boundaries conversation. This is a standards conversation. Those are different things. When we get to a point in our mindset upgrades, in our owning what we value, owning what we want our experience of life to be, knowing that we get to build empowered and authentic relationships where we are cherished, loved, and respected for all that we are, the conversation then goes from boundaries to standards. And instead of, no, I can't do that, the conversation becomes, or the thought process becomes, this is what I require. These are the experiences I will have. This is how this gets to come into my experience. Instead of, I'm not going to have any of that, or no, I don't do it that way anymore. Instead of boundaries being the no conversation, standards is the how do I most say yes to me in this moment conversation. How do I most provide for and protect my values, my dreams, my desires, and my full expression? These are the types of conversations that we have when you work with me. These are the foundational concepts when you work with me, building that foundation of personal reflection and looking at these core truths and these core beliefs. This is a program that I have available for you. It is free on my website to help you see these 6 core concepts more clearly. And then into that program, I want everybody to be able to eliminate burnout. So I have added my masterclass on the 8 things you need to know to eliminate burnout. I have also added a mini course on eliminating imposter syndrome. And you also get a conversation with me to help you answer any questions and then help you accelerate your application and your implementation of this in your world. And then my programs fit in each of these phases and each of these evolutions through pre-leadership, leadership, and expansive leadership, through developing, leading, and expanding your dream practice. And each of you are going to want a different one of those programs. Some of you are going to want to do this more on your own with simply some coaching, give you some of the theory. Some of you, I've developed programs because I want to get into your practices and help you directly more quickly. So that's a program that's about to be launched soon. It's called Enchanted. There are these core accelerated programs, and then there are the expanded versions of the programs. And so I wanted to help you, point you towards the one of those that's going to help you achieve your goals the way that you love to achieve your goals, the way that you love to move forward and to do your work. This is for you. So this week, we're going to be talking about these emotions that you have felt along the way, some questions to ask yourself. This is not get rid of those emotions. This is get curious about them. Allow yourself to feel them. Allow yourself to notice where you're at, what brings these emotions in or not. What is this teaching you? What have you been asking for that this is perfect for? This is going to help you see what your values are, what your dreams are, what your desires are, and what your true full expression is. So many people say they don't know, but paying attention to these things is going to very much help you in that process of what do I actually want? How do I actually want it to feel? When I talk to healthcare providers, so many of them say, oh, I just need to get through this burnout thing, or I just need to get through this imposter syndrome thing. And then I can work on what I actually want or developing my dreams. It doesn't work that way. Instead of moving away from, you're going to move toward. What is it that you are moving toward? The more energy you put into a thing, even if it's getting away from that thing, you're still putting energy into that mindset and that thought process and into that system or that structure, whether it's one you abhor or one you love. So what you're going to do is you're going to switch and take steps toward what it is you desire, but I want you to break those steps down. What's the tiniest thing you can do right now to move you toward that goal? Okay. And the tiniest thing you can do right now is hit the subscribe, the like, the follow, whatever your platform you're seeing me on button so that you can join in these conversations this week. I'll see you soon.